Hi, everyone. Thank you so much for tuning in. My name is Hannah. This is Shelby, Miranda, and Haley, and we are second year medical students at the John A. Burns School of Medicine. We went to Palau this summer for a 4 week rotation, and while we were there, we decided to do a study examining the characteristics of opioid seeking encounters at the Ministry of Health Hybrid Clinic in Palau. Opioid misuse is a global public health issue, but there's been almost no published data from the Pacific Islands, including Micronesia, Melanesia, or Polynesia. So, in response to this, Palau's Ministry of Health opened the hybrid clinic in 2024 to centralize opioid care and improve oversight of opioid prescriptions. Our study aimed to better understand who is seeking these opioids in this setting and why, so we can inform smarter health interventions both locally and across similar island nations. For our study, we conducted a retrospective review of patients who visited the hybrid clinic between December 2024 and April 2025. We collected data on patient demographics, diagnoses, opioid prescription histories, and their stages of change using the Trans-Theoretical Model, or TTM. This measures motivation to reduce or stop opioid use. The analysis used descriptive statistics to summarize our findings.
Out of 711 clinic encounters involving 91 individual patients, over 73% were male and nearly 44% were between the ages of 50 and 59. Almost half had a diagnosis of opioid use disorder noted in their chart, and other common conditions included musculoskeletal pain, injuries or amputations, and osteoarthritis. TTM scores were available for just over half of the patients as well, and among these, a striking 80% were in the contemplation stage, meaning that they were thinking about change but not yet ready to act. And only 6% were in the action stage, and just 2% were in the maintenance and relapse prevention. Additionally, over 85% of the encounters involved chronic conditions, highlighting the long-term reliance on opioids for pain management.
Our findings point to a clear opportunity for intervention regarding opioid use in Palau. As exhibited by our data, most patients are contemplating change but not actively moving forward, suggesting that they may lack access to support or alternatives. The high number of repeat visits and opioid use disorder diagnoses could also reflect under-recognized dependency issues or gaps in pain management. To address this, Palau urgently needs structured addiction treatment programs, opioid stewardship protocols, better health recording systems, and a greater involvement from addiction specialists when possible. This study establishes a much needed foundation to guide public health policy and improve care for those impacted by opioid use in Palau. This also inspires other islands in the region to dive deeper into opioid use trends in their nations, a very underreported research topic. Thank you for watching. We hope this work inspires future research and action to support Pacific Island communities. We'd also like to thank the Palau Ministry of Health, Palau Hybrid Clinic, Palau National Hospital staff, and the Palau Area Health Education Center, also known as AHEC, for allowing us to conduct this work. Thank you.